Good afternoon. Kelly Frankie and I will be talking about mental health obsessions today. So, welcome. Just waiting for Kelly to join. Let's see. I think she's going to be. Aha. I hear you. I don't see you, though.
Uh-oh. Hold on, it says it's connecting.
Oh,
Um,
connect. Shall I tell people about our sponsors while your video is connecting?
yes, except for the fact that
Oh no.
we might have to restart it. That's the only issue.
That's true because of the video situation.
What in the hook is going on?
What in the hook? I've never heard that before. This second.
Oh, you guys
Oh
are
wait,
seeing my Easter bunny. Hold on.
that's really cute. Oh my
Okay.
gosh, I see your face, dude. What's
Dude,
happening?
what in the world?
Well, I
Let's see if
know.
I'm glowing still. Kind of. It's like a white
I don't think you.
glow.
I
Do you
mean,
see
like
that?
you're always glowing in a good way, but I don't see you. Whoa, well, that's yeah.
But see, that's how it was. Like
Oh,
this.
like that? Oh
It's
dear.
like an angle. Sorry, guys. I'm just,
No. Hey, we're
life.
doing it live, man. This is how we do it. This is how we roll.
You,
Shall I tell people about things and stuff? What do you think?
yeah, your face has a giant circle in it. I don't know why.
It does?
Mm-hmm.
Still, right now?
Mm-hmm. Does anyone else
Guys,
see it or no?
do you guys see it? I don't see any circles. Oh my God. Like a circle of light? Like what's happening?
It's almost like it's just spinning because I don't have, maybe it's connection. I don't know.
No, no.
Anyways, let's just keep going. It's probably on my end.
Well, we'll keep going and then we'll figure it out. Okay. Well, thank you, Carol, for letting us know. If you have any questions, pop up, throw them in that question mark box to the right of the comment section so that we catch them. And we do have quite a few questions today because we have some from last week and some that were asked. Anyway, I have them on my computer in front of me so we can talk about them. And before we get to that, this episode of Purely OCD is sponsored by NOCD. If you're looking for therapy for OCD, NOCD, or no CD, I still don't know, offers effective, affordable, convenient therapy for OCD. At NOCD, you can do live video sessions with a licensed therapist, and between sessions, you get support from NOCD's self-help tools and peer support community. Take the first step toward getting better by going to www.nocd.com and booking a free call. So there you go. That's our sponsorship. We're real happy that
Yeah.
to be collaborating with them. So mental health obsessions. This is a
Oh,
personal
yeah.
favorite. Yeah,
Fan favorite.
fan favorite. Except for it's really not my favorite because I swear to God, this is like for me, myself personally, and for the people that experience it, it's a tough one. I think
Yeah. It's pretty brutal.
it is brutal. Because of course you want to get better, and then stupid OCD just comes and snakes in and is like,
Stupid
some
OCD. Was that too aggressive?
no, it's like the right amount of aggressive for OCD. I
Okay.
was like, of course, your brain's like, well, but what if you don't get better? And what if you can't get better? And what if you're just going to
Right.
be sick forever? And what if you're going to get sick with other mental illness?
Yeah, are you sure that's even OCD and that it's not that you're bipolar and you're not feeling mania instead of
Right.
anxiety?
Or maybe you're
Um,
psychotic. Maybe, right? Like,
right, you're dissociating because you're anxious, but is it really the anxiety?
yeah, maybe you're actually convinced that you live in another world, right? Like, or not another world in the existential sense, but like maybe you
Well, it
have
certainly can play
psychosis.
into that. Yeah.
Well, for sure, absolutely. That's some of the questions that we got is like, how does that play into it? Um, but yeah, and I've even had people come into my office who have been previously misdiagnosed. How about
Oh,
that?
wow.
Right?
With what?
With psychosis, actually.
Wow. I think
Yeah.
I've seen that one other time.
Yeah.
Um, and they were even on uh, a pretty, not because, with OCD, it's not uncommon to see an antipsychotics from time to time.
Right.
But this was
Totally.
like not the right dosing. I was like,
Yeah.
not that I'm not a doctor, but I was like, this
No.
is something's off.
Yeah. Yeah. Well, so favorite obsessions.
Well, that was a few.
Yeah,
Um,
those are some good ones. Yep. What if I'm bipolar? What if I'm depressed is a good one too.
what if I'm depressed? And what does that mean? And that goes into like the self-harm stuff, or
Definitely.
oh, it can go among many other things.
No, it's so true though. That one comes up a lot, I think, within like those two overlap a ton.
Right. And we were talking a little bit about this in health anxiety last
Hmm.
time we met. And um, yeah, I think the major ones that I think we see in particular are some type of psychotic disorder like schizophrenia or delusional stuff, bipolar, borderline. Um,
Hmm.
I've had a lot of clients as of late say, like, am I borderline? I'm like, why do we want to know? Right. And
Right.
yeah, that's
Right.
question number one.
Yeah.
Uh,
Why are you asking?
why are we here? How did we get here? We are just talking about something else.
Yep. Yep.
Anything else in terms of
In terms of the feared, I was gonna say sometimes the fear of psychosis overlaps with harm OCD. So those two can kind of
sure?
be interchangeable just because there's this idea that, what if I'm hearing voices and what if the voices in my head tell me to hurt somebody? And that can be really messy too because you are hearing a voice. It's probably your own voice that's in your head that,
Right, right.
thinking, um, yeah, just the idea that you're having thoughts about harming. What's the difference between that and and having a voice tell you to harm somebody? And that's I think a lot of people with this subtype ask, how do you know? How do you know the difference? Which is not terribly surprising because I think that that's true of most forms of OCD. Is like, how do you know it's OCD?
We don't.
And we don't
We know.
ever.
We just know enough.
Yeah, we know enough. We make our best guess and we go with that and we
Right.
see what happens. Maybe we're wrong, which
I.
nobody likes.
No one likes that one.
No,
I
no,
certainly don't like it as a
no,
therapist or as the receiving end. But
no,
um,
no.
there was something you said that I was going to. Oh, the fear of harming. I think on that same token is saying, well, what if I dissociate and I don't remember and I do something,
Mm, yeah,
right? So I think that can also play a role in that. I have also had clients go, well, what if, do I have panic disorder? Do I have health anxiety? Like they go through the, the crossovers and they want to know exactly their diagnosis. I'm like, well, this sounds like a little bit like obsessing on obsessing, right? Like they're trying to
mm,
get to the core of the issue so they can hit
fix
it
it.
right away,
Yeah,
right? Again,
but
nothing fits in a box. Like here we are talking about this, but we were just started talking about mental health. It just
yeah,
can spin out in so many ways.
yeah. Well, and I like sort of uh, dipping my toe into the realm of compulsivity and going off of what you were just saying. I think that there can be a lot of overlap with mental health obsessions and the compulsions that they engender, as well as health anxiety and
Yeah.
the compulsions. Like a lot of compulsive research, Googling. Right? There's a lot of wanting to understand, which again, this is tough because it's not like, of course, you want to understand your diagnosis. Of course,
Mm-hmm.
having a general idea of what you're going through, that makes sense. But it also, I think you can go down a rabbit hole pretty easily with Dr. Google.
Yes.
Yeah.
And just a reminder, if you guys have questions, because I'm seeing a ton come up, just to put them in the question box, because we will try to get to them.
Yes. Yes, please. Oh, also, this is not a replacement for therapy. This is for educational purposes only. Just wanted to
Boom.
remind everyone and myself and you, I guess.
Yeah. Where is my brain today?
No, I'm mine in the same place as mine, apparently. Um, all right. So, other obsessions? Did we? I think we covered it.
I think that's about right.
Yeah.
Yeah.
Yeah. What if I'm mentally ill? And what if
Right.
I don't get better? And that kind of stuff.
Right.
Although then we're getting into the obsessing about obsessing, and we're going to do a totally different episode on that as well.
Did we do an episode on that or no?
I don't think we did. I was looking at it the other day. I was like, what do we have left to
Really?
do? Yeah, I don't think we did. I don't think we did
That's
treatment related obsession.
really, that's bizarre.
Yeah, I know it's one of our favorites.
Yeah, that seems like, why wouldn't have that been the first one?
I
See,
don't
my
know.
face turned, I'm glowing. Look
You
at,
are glowing. I
what
don't know
in
what's
the,
going on.
okay.
Oh, you're not glowing anymore.
Anywho, yeah, I think we covered it.
Yeah,
I'm sure we'll come back as we always do.
as we do.
So,
Compulsions.
common compulsions. Hmm.
A lot of emotional checking. A lot of like, do I feel it now? What about now? And whether that's depression, whether that's mania, whether that's, pardon me, or like checking your feelings to see, oh, well, do I feel happy or is this mania?
Right.
Um, or do I feel real, like a sense of unreality right now that could be indicative of maybe of psychosis, right? Um,
Right. Looking for, that leads into reassurance, which I know I had brought up at some point about how a few of my clients have looked for cues that say, okay, do the people out in public are they looking at me? Are they looking at me having a conversation, or does it look like I'm having a conversation with someone else? Because if I was having a conversation with nobody, say they're talking with one of their friends, sorry,
yeah.
I'm really all over the map right
No,
now.
I'm with you. I'm with you.
And someone in public's looking at them like, who is he talking to?
Right.
They would be like, oh, we'll see. They're just looking past me. If there was nobody there I'm talking to, then obviously I've lost the marbles.
Yes. No, that's a, wow, that's like a nuanced one and a really, yeah, a
I've
good one
seen
to
it
call it out.
twice though, like checking for social cues for
Yeah.
delusion stuff,
Hmm.
delusional obsessions.
It reminds me of the movie A Beautiful Mind, right? Where
Mm-hmm.
he's,
Yeah.
yeah, for most of the movie talking to, oh, spoiler alert. If you
Well,
haven't seen A Beautiful Mind,
I mean, I hope that you have at this point.
it's been a while. It's been
Yeah.
like 20 years. What? That's weird. Okay. But I digress.
Yes. Okay. Compulsions.
Compulsions, so reassurance seeking and sort of seeking reassurance through like a lack of action, like you were just talking about
Mhm.
on others' parts. That is that sort of like also just sort of floating ideas out there. Like, did you hear that, or did you see that,
Oh
or right?
yeah.
Like,
Yeah. Did you
it's
hear
almost
that is a big one? Yeah, did you hear
yeah,
that?
yeah, yep. So that, what else?
Um,
Dr. Google, the checking.
I've had
Rumination
someone,
is,
yeah, rumination. Um, shit, I just lost it.
sorry.
No, no. Well, obviously the avoidance of any triggers like movies, like Beautiful
Mhm.
Mind, Shutter Island.
Mm, yep.
Um,
Not wanting to watch TED Talks or read articles or, you know,
why
etc.
TED Talks?
Well, I just mean TED Talks, anything that's about this information. I think of the
Oh,
TED Talks because I have two really good TED Talks that I use for this
which
variant. Okay, so
one?
there are two videos,
Mm,
one of Ellen Sachs and one of a woman named Eleanor Longden or Longren. I can't remember exactly. She's Scottish, I think. Anyway, they both have psychosis or they're sort of in recovery from schizophrenia. And so they talk about their experience and how they've walked through it and overcome it. And I think especially the way that Eleanor Lundgren, it's awful. She's amazing too. I wish I
Is
knew her
that the
name.
professor at Stanford? Or
I don't think so. No.
okay.
Um, there's one of them is a professor, I think at USC, but she was at Yale Law, and she has a book called The Center Will Not Hold.
I think that's what
And
I was thinking of, not
yeah,
Stanford. I've seen that TED Talk. It's very good.
it is very good.
It
But
is.
I
Forgot
feel
about
like
that.
for some reason Eleanor's is like really almost relatable in the way that she talks about it as somebody who has OCD, right? Like I listening to it, the way she talks about it is very much, I don't know. I
Right.
don't know quite how to explain it. So it tends to be really triggering for people
Right.
as an exposure. And also, of course, something that somebody might avoid if they're being compulsive.
Right. Can you send that to me?
Oh, yeah. Heck yeah. It's so
Okay.
good. It's
Okay.
really good.
Um, what else?
I
Avoidance.
actually, can I throw out an obsession that I forgot
Yeah.
to mention? Because, off the rails a little bit. Um,
Right.
I I've worked with people who are afraid of contracting mental illness by
Yes.
hearing about it, like substance use disorder or um, like eating disorders, that kind of stuff. Like they don't want to hear about it or talk about it because they're afraid that which it's sort of this variant mixed in with some magical thinking.
Uh-oh. You there?
Oh yeah, can you hear me?
Yeah, it stopped for a second. We
Good.
talked about this, I think, with the emotional contamination stuff, right? Is
Mm-hmm. Yeah.
I
Yeah, yeah,
think
yeah. You're right. You're absolutely right. The sort of the catching sort of personality traits, but also potentially catching mental illness. Yeah.
totally.
Yeah.
It's I've seen it a few times myself. It's definitely, it's interesting. I find myself even on this live when we're talking about anxiety and OCD. It's just ironic because I always get kind of hesitant when we talk about like talking about it being on a delusional spectrum because
Mhm.
I'm so concerned I'm going to trigger
Somebody.
thousands of people like thinking they're delusional. But the
Right.
reality is like it's such a spectrum,
Yeah.
and yeah,
Right.
maybe
And
that's
the
my own unprocessed anxiety I have to work on.
no, but I understand what you mean. And obviously, in some ways, you and I both in the work that we do are like, I don't want to trigger you, but at the same time, it's like, and we need
Yeah,
to, right? And we need to learn how to navigate the triggers in a sort of gradual way. But I get what you mean. It's like you don't want people to be like, "Oh my gosh, maybe I am delusional then." But at the same token, we have to learn to live with the what ifs.
right,
All of them,
right,
those dastardly mofos.
right.
Yeah.
Yeah, it's unavoidable. Just like getting reassurance is unavoidable. But I think it's also having the right information. So, um, yeah,
Yeah.
Dr.
So
Google
back to
provides a lot of information. Uh, I love when clients come in and they're like, "Yeah, but Google said all this," and I'm like, "Okay, and it
and
presents very differently." Right? Like
yes,
if you read the DSM criteria for a lot of things, it's like, oh yeah, like you could almost fit yourself into any type of category if you're anxious
for
enough and
sure.
overthink it enough. But to see something presented in a room is way different.
For sure. And I I think most people fit into some categories of each diagnosis, right? Like
Hmm.
you take something like borderline personality disorder, which a lot of people do have anxiety. Like, what if I have that? I think just side note on the personality disorder thing, I think people get especially freaked out by personality disorder diagnoses and what if I have that because there's this unfortunate stereotype or misinformation that they're intractable because they're personality disorders, right? Like that there's something sort of inherent that can't be shifted or changed, which is actually a myth, right? Like borderline personality disorder is very treatable, and with DBT, dialectical behavioral therapy. Um, but
Well, yeah, I do think they are a little bit more rigid in terms of change. Um,
sure, what I mean to say is that there's this conception of like, oh my gosh, if I have that, then, and I think it's true
it's
of
the
all
end.
of these
Yeah,
disorders, it's the end. Like
it's the
everything's
end.
screwed. I can't, there's nothing to be worked on. And yeah, I think
But
the
yet, people with
reality,
personality disorders don't want to do that. It's so ironic. But yeah,
it is ironic. But I think in terms of, if you look at going back to this conversation about like the diagnostic criteria, I've historically certainly fit some of those, those criteria, right? Like an extreme fear of abandonment. Don't we all have that at certain moments? So if you're to the untrained eye looking at these different symptoms, it's like, well, shoot, I have this and I have this and I
right,
it's something that happens to doctors in med school, and I think probably psychotherapists in the context of graduate school or their PhD programs is, oh my gosh, well, what if I have this? What if I have this? Um, so
right.
anyway, did I go off the rails, Toodle?
No, you didn't. I'm just
Okay.
getting distracted. I'm trying to read the feed and listen and then manage just sensory
Mm-hmm. Mm-hmm.
overload.
Feel you. Should we breathe?
Okay.
I needed a deep breath. It was a good one. I liked it.
It's painful.
Painful deep breath. So exposures? Question mark. Are we to exposures?
Exposures. Yeah, let's do that.
Yeah.
What are exposures?
Words.
I'm just kidding.
Yeah.
I'm
What's an
here.
exposure?
Um,
Words. Lots of
we're.
words that could be scary, right? Like psychotic or
I thought you were saying like words like you can't think of
oh,
words. Oh
I
my
often do
God.
that. No, I do that
It's been a
all
long.
the time. All
Right.
the
Yeah,
time.
yeah. Words are
Um,
triggering.
Words are triggering. Yeah, psychosis or like I mean the different names for things. Um, but then also, gosh, I've wanted to get my hands on this for a long time, but apparently there's like a tape that they have. A friend of mine went through an occupational therapy program, and it basically simulates having psychosis.
Oh my whiskers.
I know, right? Wouldn't it be great to have that as an
No,
exposure? No, no,
no,
no.
no, it would be great, but I think I'd have to just drown myself in it first, just so I
Oh,
could really.
appreciate it.
How do they do that?
I mean, I think it's just the idea is audible hallucinations, right? Like, and
Like
voices.
with genuine themes in the DSM?
Oh yeah, I do. I assume so. It
Like
must be like,
persecutory and all the.
right. Yeah, yeah.
Interesting.
Yeah,
How interesting. Okay, cool.
super
Sorry,
interesting.
guys.
Yeah,
Cool.
little therapy nerding. Um, yeah.
Yeah. Uh,
Um, so, and they even have a YouTube video that's supposed to like, I
do
don't
they?
know. Yeah,
I'm missing all these amazing exposures. You're gonna have to forward me that as well.
yeah,
No
yeah.
rush, but
No, I'm on it. I'm keeping tabs right up here in the old noggin.
okay.
Um,
Thank you. Someone is. Thank God.
yeah. Well,
Um,
I didn't say it would stay there for long,
I will
but
say this. Yeah, go ahead.
no, I don't think I was going to say
No,
anything.
you have the tabs, lady. Okay. You want me to
The
go or
tabs.
you go?
Go,
I go.
go. Mhm.
I was gonna say the last 2 weekends have been the first time in 14 months that I've done things outside of my house. My family's fully vaccinated. I'm fully vaccinated, and I have had so much intense dissociation
Mm.
and depersonalization, and I've been here before, and so I go, okay, let's not panic, okay? Let's not get too crazy here.
Oh, look, it's here.
It's
Interesting.
here. It's here. It has
Yeah.
arrived. I'm close to losing touch with reality any second now. T minus. And
Gosh. That's one of my
I've
favorite
noticed
interventions, actually. Sorry, go ahead.
what?
Go ahead, because you're in the middle
Saying
of.
you're gonna lose. Okay.
Yeah.
So um shit. What was I gonna say? Shoot. Was that that I've noticed too with a lot of my clients who also have, and for some reason I have bucket loads of clients who have this obsession right
Mm,
now.
yeah.
That them and they're changing in their environment or like tweaks into their external stuff, like going back out into the world, back
Mm,
into the wild and
yeah.
readjusting post COVID stuff, even though we're not post COVID.
Yeah.
But
But
yeah, like they're vaccinated or they're trying to get back to normalcy, that they're also experiencing that. Of course, I don't tell them that, but if they're watching now, they know.
yeah.
Um, but it's just interesting. It's almost an exposure, right? Because your brain is in your body or doing things you're not used to. And
Right.
it's like, we aren't supposed to be this close. What's going on, right?
Right. And it's likely to feel surreal. It is likely to sort of
Very
generate
surreal.
those experiences of like, well, this is very weird. It should feel normal, but it doesn't feel normal
Right?
because we've not been doing it for a while, right? But very easily could, uh, I could see this. Yeah.
Yeah.
I feel like I don't have anyone who has, well, that's not true, but nobody who's had that particular sort of manifestation of it, given the going back out into the world post, well, not post, but semi post COVID, toward end. You know what I mean?
Right.
Anyway, my one of my favorite interventions, though, because you said like, is to. I actually had a therapist do this to me once. Because I did, I totally had fear of like, oh my gosh, am I going to lose my mind? And she was like, okay, you're gonna remember to have a breakdown at like 5 o'clock and let me
Mm-hmm.
know, like let me know how it goes, but 5 o'clock today, like just whatever a breakdown is, but like make sure to lose touch with reality and keep me posted as to how it goes. Have a blast. I think we've done that with each other actually.
Yeah,
Yeah.
absolutely. I still have my alarm. I should actually get that guy back in the circle of life for
Yeah.
exposures for me. Get him, pop him in. I think he goes
Pop them
off
in.
at 5:01 p.m. Where is your mind? I think it says.
Where's your mind? Where is
Yeah,
it? Did it go away?
yeah.
Maybe it did. Maybe it will.
Um, and just to be clear, I saw someone a few ticks back say derealization, depersonalization is not losing touch with reality. And I agree. I think that me saying that is actually sarcasm,
Yeah.
but it's this feeling that it stimulates like this, you don't have control. And so for a lot of people with anxiety and OCD, they think worst case scenario. And for a lot of people, it falls into this is never going to get better. What if I'm losing my mind? Right? What if
Right.
I am losing touch with reality? So,
Well, right. It's the very same thing as somebody who has a fear of psychosis, seeing something out of the corner of their eye. We all have that experience, but if you have that particular obsession, you're going to think, "Oh my gosh, is
right.
that psychosis?" Well, the experience of derealization isn't a terribly uncommon one. I think most people experience it to some degree at some point in their lives, but within the realm of OCD, that we take these things and go, oh my gosh, but what if this means this horrendous, awful thing?
Right.
Like, and not to, but I guess having a mental illness, right? Like you'd prefer not to accrue more if you could help it, I suppose.
Right.
One would. I mean, as someone with several. But anyway, yeah,
Yeah.
yeah.
So, okay. Sorry. I didn't mean, I think I derailed us a lot.
No, I don't think you did at all. I think we're on the rails. It's just we took a
Okay.
little turn. Um, so exposures, yeah, like being like,
Exposures.
okay, well, yeah, lose your mind, see what happens.
For some reason, when I'm in that one, like doing like deep belly breathing and like really physically opening up, like Shala nicely says, like shoulders back and belly out,
Yeah.
really physically, because it's such a physical sensation, is very, it's scary. I gotta say, it's one of my top scary. But everyone's
Yeah.
different. You know, like someone writing a script is gonna maybe get more triggered, um, and that doesn't mean that one's working better than the other, by the way. So
No, just everyone gets triggered by different things and associations for sure.
yeah.
Yeah.
So imaginal, uh,
Yeah, imaginal for sure. I think I'm trying to think of another good one.
watching things like Shutter Island.
Right, for sure. Watching things that are about, and then watching things, or I. So here's the thing. I don't think that you can force yourself to feel sad. That's a difficult thing to do. But the acceptance of sadness is a really, and like, and it's, I guess it's E and the RP all together, but it's
Totally.
powerful. This idea of like, I'm just going to allow myself to feel sad, and maybe I'll play sad music and I'll watch sad movies, and maybe I'll be like this forever. Maybe I'll always feel like this.
Right. Yes. I actually have a client where oftentimes when she does feel sad, she immediately, the compulsion is to immediately do something that makes her happy, right? And to say like, okay, look at, and then mentally review all the good things, you know, these positive things in her life. And ultimately what ends up happening is later on, she ends up getting really sad and crying because she didn't let herself experience that anyways, right? Like,
Yeah,
so we've been working on that. It's just, if you feel sad, be sad, cry. Just because we're crying doesn't mean we're going to get depressed, and just because we're depressed doesn't mean we're going to kill ourselves.
right,
Wild
right.
concept.
So wild, but
Yeah.
so accurate. Well, and I think here's something to sort of like throw out there is that you can feel sad without pushing it to the sort of full expression of sadness. So I know that because I have had this historically, that the sort of continual like falling to tears when you are afraid that you're going to be perpetually sad or depressed. You don't it's not I don't think it's like thought suppression or trying to push away the experience. If you say, okay, this is sadness, and allow myself to feel this, and if tears come, great, but I don't need to like sort of sit there and focus on it and like really sink my teeth into sadness, if that makes
Right.
sense.
Yes. Sorry, I don't, my phone's not on do not disturb. It's all
Oh,
distracting.
I
Yes,
understand.
I agree. I agree. I think that that's just being effective in general, though, right? Because we don't want to sit in sadness because it's not, it can get in the way of our life, right? So it's like a
Right.
fine line.
Well, it's
The
like
same.
we talked about with, sorry, go ahead.
Well, I was just gonna say, like, it's like, you know, if you have to get up and get your kid dressed and fed, and, you know, you can't, you have to say, like, when is it now the sadness becoming ineffective, right? So you can be sad, and then you
Yep.
can say, okay, I'm going to bring sadness with me, just like anxiety.
Yep. Totally. That's what I was about to say. Like, bring it on the knapsack
Yeah.
and get on your
Strap,
merry way.
strap that
Pack
guy
it.
on.
In fact, I've had a couple of clients who are like, "Oh, but I can't go into the grocery store, or I can't do this or that because I'm gonna cry." I'm like, "No, no, go ahead, cry in the
Right.
grocery store.
Yeah.
I've done it before. It's fine.
I
Sometimes you just
I
need to
have
cry in the
cried.
grocery store."
I mean, I think I've cried everywhere. I
Well,
quite literally.
I don't
Where
know if
have
I've
I
mentioned
not
it on
cried?
here. Right. Well, that's a better question. I almost, when I was crying a lot a while back, I don't even remember when it was, but I thought about starting an account. This is well before I think I even started this Instagram account. It was like places I've cried and just like post exposures in different places that I'd cried because it was just like, okay, I guess I
Oh my
cry
gosh.
everywhere. This is cool. But all of that to
Wild.
say that like it is really about accepting that you're going to have a whole host of feelings, and in the same way that we want within the realm of exposure, if you're feeling happy, go with it. Allow yourself to do whatever happy thing it was that you were thinking about doing, and really like play into it. And oh
Right.
well, maybe you are manic. Okay.
Right. Like the surge of energy is
Mm-hmm.
somehow now I'm manic. And I'm like, it's not the only thing involved. But,
No, but maybe
but maybe, maybe.
maybe.
So exposures, writing words sometimes is,
Mm-hmm.
especially with this one in particular. I think like the word schizophrenia can be very triggering for a lot of people.
Mm-hmm. Mm-hmm.
Um, Take a deep breath, everyone. If you got triggered, right?
Yep.
It's just, it can be very triggering, just that one word. And it's just letters. And then you could scramble them up, and it's
Yeah.
still, it's just the association you've made to just these letters that are in this
It's
particular order,
order. You know, it's
right?
funny though, because I know historically we've talked about how like looking at a word over and over again can lead to a feeling of dissociation. So you may actually end up like writing the word, starting to not feel as triggered by the word, and then trigger
Right,
yourself with the
right, right.
dissociation, which, hey, it's a twofer.
Yeah.
Yeah.
I've had a client get a chair because I said, well, what do you think if somebody was losing touch with reality? Like, what does that visually look for you? And they're like, it's somebody in a chair that's a stationary chair, like not a rolly chair, that's just staring at a blank wall. And I was like, well, that's what we're doing.
Mm-hmm.
And they did it. And, turns out they got better, not just from that one exposure, of course, but it's an idea to
No, it
think
is an
about what's your
idea.
feared thought, and work
Yeah.
towards that in some way.
Yeah. Like what's the image? I like that. I like that. Like my image is of, sitting in a corner rocking,
Rocking.
drooling a little, like
Yeah.
something like that, I suppose.
Something like that. Yeah.
Not, I don't mean to speak lightly or even to
No,
sort of
no, we know.
stereotype,
The
but,
fear in your mind is
it's
that
the
though.
fear. Right. Exactly. Exactly. Um,
Um, okay, another
yeah.
exposure, setting alarms. We talked about that.
Yep.
You
Yeah, I
could
think
even do a audio recording where you're hearing, just
voices.
random sounds. Yeah.
Yeah. Yeah, for sure. I think that's pretty, you did a pretty good job.
Okay.
Self five?
High five.
Self five?
Boom.
Nice. Boom. Nailed it.
Nailed
So,
it.
just a reminder, if you have questions, throw them in the question mark box. Should we start with some of the ones that came in before and then
Yeah.
go? Okay. So here, I'm just gonna throw out from last week real quick. I obsess about whether my meds have stopped working. And then this person says, how can I work on this? Obviously, we can't give direct advice, but this, I thought it was worth mentioning that this certainly is, somebody could potentially have a thought like, oh my gosh, what if my meds stop working? What if they're not working well enough? Maybe right, and could end up compulsively like changing meds or,
Oh yeah. I'm
yeah,
I'm sure you've had a client like this,
hmm yeah,
Right.
yeah.
So
Just thought that was worth mentioning.
yeah, and we can't because we're not, this is education purposes only. Let's hypothetically assume that that is the obsession
Yes.
and that it's not a true fact, right? The meds aren't working, but that it's really an obsession. So hypothetically,
Yeah.
how would we approach that? Well, number one, we would say, I don't know, where would you start with that one?
I think that the goal would be to right, like if we're looking at the ultimate aim is to accept uncertainty of, like about like this is how we do this with every subtype. That well maybe your meds will stop working, and we'll
Remove
have
urgency. Yeah, sorry, go ahead.
Right. Well, and just to not respond in an urgent way. Yeah, maybe that will happen. I don't know. I don't know. And then to allow that feeling to really come on. I think, I mean, I'm just such a fan of turning passive exposures into active exposures and saying maybe, okay,
Yep.
and then feeling the terror, the crazy terror that
Mm.
hits right
Yeah,
to the
it just
yeah.
right to the gonads, man. Female and male and
All the
everything in
gonads.
between.
Yeah,
Yeah, I would say too, it's just funny because you this person hasn't told us anything about themselves, but like automatically, Lauren, you already say like what already came to my mind, is like, oh, then they want to compulsively go to different psychiatrists or get input and
yeah,
change meds. And so for me, like what stands out is saying like, okay, we're going to turn down the volume on urgency and just say like, if your medication is truly not working, you know, let's give it like a week because nothing could be like happen in a week's time, right? Like let's kick it down the road a bit where it
right.
couldn't be like you're in therapy, right? You're doing the work, someone's
Yeah,
tracking you.
yeah, yeah. It's
So
hard
getting rid
though.
of the
I mean,
compulsion.
I'm gonna throw something out there at the risk of being triggering. Can I do it? What do you think?
I mean, I said schizophrenia. I'm sure that,
Well, this is a little bit more triggering. I was gonna say that I think one of the things that people worry about with medications a lot is the like the black box warning, which is essentially that you might be an increased risk for suicide if you take SSRIs. We're not doctors, but this is a pretty commonly spoken of phenomenon, and it's not a common phenomena, mind you. But the sort of fear of like, oh my gosh, but what if I just, now change my mind and want to do this thing? That you can imagine that popping up as an obsession as well.
right?
Yeah.
Got it.
Right?
Yeah, totally.
I mean, and
Absolutely.
but to your point, to sort of delay responding, it's like, okay, well, I'm not going to figure that out right now. Maybe I'll figure it out in a week or a month
Yeah,
or tomorrow. But right now is not the time. Not doing that.
right. It's just turning the mind a bit,
Yeah. Yeah.
as they would say in DBT.
Is that I don't know that one. Can you tell me a
Turning the
little bit
mind.
about that?
It's just like
Turning what in?
redirect, refocus, you know?
Oh, that's
It's
cool.
like when you're over attending to something and saying, it's here and let's turn our attention, right, to somewhere different.
Yeah. Yeah.
Um,
Yeah. Okay. So definitely people talking about obsessing about having a personality disorder. Um, we've talked about common compulsions. Somebody asks, how do you know if it's an obsession versus normal thinking? Would you like to field that
how do
as
you
I,
know it's what?
if it's an obsession versus normal thinking?
We
Which we kind of,
don't.
yeah, exactly.
Yeah, that's a scary one. That's what all OCD is, right? Like, is this OCD or is this? Um, I think too, when people get like words stuck in their head, even if it's just a neutral word and it's not schizophrenia, that can become very much triggering for. I've seen that before. One other time, um, maybe two other times. I take it back,
Hmm.
where they had just like a neutral word and it was just stuck and then they were just obsessing about why it was there and then all of a sudden it evolved into what if
Hmm.
I've gone round the bend, daddy?
Gone round the bend. Yeah.
So
No, that's. Can I go on a brief sort of tangential tirade about something that just
please.
popped into my mind about all of this? Is that there's this general fear, and we've talked about these terms like breakdown or losing it, or right, like there are all of these larger or terms that we use in the culture at large, and I think that they do us all a great disservice because I don't actually, we have this sort of general idea of mental breakdown, but I remember growing up thinking that that was a specific thing, right? Like a breakdown looked a certain way, or you could have a nervous breakdown, um,
Right.
which it's not really a thing, right? Like you can have emotional challenges that, like, there's not a clear cut, like, now you have broken down. And so I think it kind of supports this idea that we shouldn't be accepting of feelings because feelings are somehow a threat to us that at some level. And look, there's not to discount the fact that some people do experience psychosis or challenges that might be considered a break with reality. But by and large, emotions aren't. That's a very, not to be totally reassuring here, but that's a neurologically based disorder. It's very, 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 to my understanding, driven by genetics. And so I have this sense of like, oh my gosh, if I feel too much, then I'm just going to break, and then I'm done for.
Snap. I think
Snap.
I've used that word, snap. Like, feels like my mind broke. And I
Yes.
remember telling you that, and you're like, Kelly, reverse. Like, get the fuck out of Dodge right now, because you know where this is going, lady. Like, it's
Warning.
just warning. Warning.
Reverse. Yeah,
Oh,
no,
shit.
sorry. It's true. Um, but yeah, so I just sort of tirade because I do think it's really important to acknowledge that, like, there's no feeling that ends you. Like, you can feel them all. I've said this, I think, in this show before, is like, you're large enough to contain all of your experiences. That's a Dr. Hayes talks about that, Dr. Stephen Hayes, and I love that idea. Like, it's in you. It's not like it's going to, like,
Right.
yeah, demolish you. You've got this.
You were meant to experience all the feelings, right?
Yeah,
That means you have a healthy brain, actually.
yeah.
That you're a healthy human that you can experience. Although I was going to, that actually reminds me of like when there's a blunted feeling, which I
Mm,
know you know that like when there's a lack of feeling, then there's what does that mean?
right. Why am I not feeling this? And you can
Why
see
am I
that.
not crying?
Right,
I should be
right.
crying.
Oh my
Why am
gosh,
I not
yes.
bothered by Ted Bundy murdering all these people and I actually find him fascinating?
Clearly, that means that I
Well,
am a serial killer in my heart.
clearly, everyone knows.
That's the only thing that it could mean, or not.
Of course,
But,
right.
you know, but still with the maybes. Anyway,
So I think it's worth mentioning. I know there's a lot of chatter going on in our live, and
yeah,
I haven't been able to read in detail what's going on, and I'm sure neither of you.
no,
And I heard people saying having a dialogue and other people triggering other people. So I apologize that we cannot go, we don't have enough time to go
no.
through and try to pull it apart. But if there are any questions or, there needs to be a follow up, um, please let us know. Right? Like, I
Yeah,
don't know. I think it's been going on from the start. It's a lot of chatter.
yeah.
And I'm
I,
not
I have
saying
been
that anyone.
honestly kind of tuning it out because I can't focus on more than one thing at the
I
same
know.
time.
Well, that's why I've been kind of out, like,
Yeah,
what?
yeah,
But I actually have no clue what's going on. But
yeah.
that's why I wanted to bring to attention. I noticed something's going on. I don't know what.
Yes,
And
yes,
I just want to be mindful of that and say, um, if you guys are asking questions, we're trying to have a dialogue. So I'm sorry, we can't
yes.
intervene at any point.
Yeah,
But please let
yeah,
us know following this if there's an issue and
for
you need
sure.
clarification.
Yeah, happy to
Cool.
do our best. Although remember, we can't give direct advice. Not you, the people.
Yes,
So if you're
good
asking for
point.
direct advice, we can't give it. But if there's something that we can clarify, or maybe even do a future live on, we'd be happy to try and accommodate that. That's good. I'm glad that you brought that up,
Yeah,
though. Yeah.
of course. Lots of movement
Mhm.
in all directions. Okay.
Couple more things on here, and then we'll maybe go to the. I know we have a lot of questions.
Mm-hmm.
Um, I'm obsessed with labels, diagnoses. If I fit one, if I don't, and the validation from that. We've been
Yep.
talking about that. And what about the thoughts that don't present as what if all the time? Those are the worst. Like the idea, and I can imagine, I don't know this person or, what they're experiencing directly, but that could be like, oh my gosh, is it a command? Because I hear it as do this. I
Lost her.
didn't turn on do not disturb and I got a phone call. Um,
How
anyway,
rude
I
they
was
are.
saying,
Okay.
rude. Come on, guys. I was thinking that historically somebody's like, oh, but I heard it as do this,
Right, a
right?
directive.
A directive, and that maybe that means it's psychosis, and that piece of things it can be very
Right.
like a trigger.
Mm-hmm. Totally.
Yeah, yeah,
Um, or just like, you're capable of doing this
yeah. You
versus
could
like,
do
well,
this,
what if?
right?
Anything that's like a diversion of the slightest degree can trigger somebody.
Yeah. Well, because we talk about what ifs so often within the framework of obsessionality,
Right.
that it's sort of like compulsively needing the exact right verbiage, and if somebody
Right.
sort of doesn't answer in the correct way, it's like, no, no, I need you to
No.
take two, do it again.
Rewind. And I want you to
Say
say
it.
it with conviction. And I say, what
Yes,
if, please?
yes,
And thank you.
please. Yeah. Um. All right. Let's see what else. How can you sit with the uncertainty that you may have a mental health problem now?
Sorry, go ahead. I'm sorry. I was reading.
No,
I'm
no, no,
distracted.
no. Um, I just think it's interesting. How can you sit with the uncertainty that you may have a mental health problem now? I would say,
Hmm.
and like I can't, again, no direct advice, but what I'm intrigued by is that what are you afraid of? People with this concern that I have a mental health problem now, it's usually that it's developing. I think you mentioned that in a previous live, right? Like that it's not like that's not full fledged because you would just be dealing with consequences then
Right.
essentially. It's the fear that some consequence is going to come up as a result of the fact that you currently have a mental health diagnosis that you're not aware of, right?
Right. Right. Right.
Or that's something
Exactly.
happening that you're going to find out about later and then you'll have to deal with it. But unless there's an issue happening right this second that needs to be addressed, then it is a concern about the future. Like it's
Right.
whether it's the future ramifications of current actions or that something bad will happen or you'll do something bad in the future.
Right. It's like, well, if I have cancer and, next week, let's say I have to go to the doctors or I have to have surgery or something, it's the what ifs that get us in trouble, right? Like you still have cancer, okay? So your
Right.
what ifing isn't going to problem solve your way out of not having cancer. So there's that, right? So there's no it's a lot easier said than done, obviously, to stop mentally ruminating about the future. Like, what if the surgery doesn't go well? Or what if this and that? It's like, yeah, but there's nothing helpful at all in any of this.
Nope.
Nothing.
Nope.
Um, I'm not sure
Doc.
if that was what we were talking about. But anyways,
No, but I thought I don't know where we started, but I think it's relevant. Yeah.
I
Yeah.
thought they were saying like a mental health issue in terms of having OCD.
Hmm. I
Maybe I
think
heard it wrong.
so. They said, how can you sit with the uncertainty that you may have a mental health problem now? Like that there's uncertainty about what health problem that you have now.
Which is OCD. Is that right?
I don't
Because
know.
why would they be on our
It's true. Well, no, because I think the same person asked about, can you
Okay.
discuss obsessions about having or developing psychopathy? Which I
Oh, okay.
imagine that they're speaking to, like
Got
there's
you.
not actually a diagnosis for whatever it's worth in the DSM. Kelly knows this, but for everybody else that's of psychopathy, antisocial personality disorder is probably what people are pointing toward, like sociopathy, psychopathy, whatever. Like that's just sort of a general term. And I think that this other question, I was sort of filtering through that lens without telling you because you were supposed to read my mind, didn't you know? Um, Sorry. But
Usually
yeah,
I do. I'm off
you
today
do. You usually,
because
we're
people are
usually,
getting nuts in
yeah,
this chat. So I'm like
yeah,
totally sidebarred. Okay, go ahead.
yeah, sidebar. Um, so yeah, anyway, all I was saying is that like I think that there's this fear like about what if I have psychopathy now, or what if I have
Right.
sociopathy now and I'm just not aware of it. But I think the fear is still, and then I do something or I have done something and I'm unaware of it and some future consequence occurs as a result of it. It's not really, it is about if I don't keep doing the compulsion, then I'm going to miss it, right? And then I'm going to do something. But it is really about some sort of consequence that has yet to exist. Because again, if the consequence already exists, you're probably just dealing with it. Unless
Right.
it's the fear is like, how am I going to resolve this? Like, what if
Yeah.
I can't resolve
Right.
this, or what if this doesn't resolve well?
Right. And until
Um,
you murder someone, you haven't. Is that kind of what you're saying too?
I think so. And then, of
Yeah.
course, there are people who are afraid that they have done something like that and forgotten about it, right? Like the
Oh,
sort of
all the time.
blackout, real event, or not real event, false memory.
False memory. Yep.
Um, but yeah, I don't know if I've sort of encapsulated it well. I think my point is that it's the fear is that you're going to come to a realization at some point that either you've done something or you are going to do something, but that moment isn't now. There's still ambiguity. There's still unknown. Um, so it's accepting uncertainty is accepting uncertainty is accepting uncertainty. It's just saying I don't know. It's
Right.
deceptively simple. Not always
Yes, it
easy,
is.
but
Man, it is. I know.
um, yeah. Okay, so let's go to the question mark box because I realize that we're probably getting close to time here, and I don't want to.
Yeah.
Do you have time?
Yes.
Okay.
As long
Question
as
mark.
we don't get cut off.
Oh, that's right. Wow. I can't see any of the questions. There's a new thing.
Yeah, they always are changing. I hate change.
Stop with the change, people. Okay, I'm just going to click on one and see what happens. See?
What?
It didn't show me this. Like when I click it, it shows me. So I'm going in blind here,
Oh,
people. Um,
I can't see anything.
oh, it says I can't get off intrusive
Oh,
thoughts and I need to think every single thought before closing the topic. Um, well, I don't. Again, we
like,
can't really give
right.
direct advice here. But I think generally when we talk about intrusive thoughts and compulsivity, right? The inability or the unwillingness, rather, probably more accurate, to drop it and disengage and come back to the present is, um, yeah, it is compulsivity in a nutshell. So I think, yeah,
So they're saying they have to have like the complete feeling, like it has to be completely
yeah, it says I need to think every single thought before
right.
closing the topic. I think through
It's,
every single thought, probably. Yeah.
yeah, I'm sure there's perfectionism in play there at some
Well,
degree,
right.
right? Like
Well,
we got
and
to be
with
thorough about all of it.
totally. Well, because if you're not thorough, especially with this subtype, I mean, with every subtype, the
Right. It's,
consequences are significant,
yeah, it's
right?
devastating.
In theory. Yeah.
Good
Okay.
question.
Good question. This is like random. Okay.
We should do like bingo or not bingo, like a lottery, like like where you the balls. Remember on the, when
The
people
balls.
watched TV instead of Netflix? And
Yeah.
sorry,
Oh,
go ahead.
back in the day, I remember. Is it common for therapists to miss this subtype or assume it's generalized anxiety?
This subtype, I don't, I probably could, but I think that's true for all OCD. I think there's, I don't know,
I
Lauren and I think are on the same page with this. Some people might not be, but in our mind, generalized anxiety disorder is really no different than OCD.
yeah.
And I think you've written a really great article on this, right?
Have I?
Oh, with Tom? No.
I don't know.
Or
We
maybe
talk.
you haven't.
No, I don't think so. But that
Well,
sounds like
he,
let's write that
well,
article.
Tom, if you're
Yeah.
watching this, put that guy up there because I think it's good. I read it. Um,
Wait, which article? I don't
it
even
was on generalized anxiety, I think. And anyways, okay, sorry. So
cite.
we can talk later about it, but
Yeah.
it's really the same thing. It's just, there's still compulsions. There's still that
Right.
obsessive thinking. It can still be really debilitating. Um, the only difference that really there is that the obsession is like what they would consider is like real life worry, right? Like
Right.
things that aren't like it would be like, well, I'm worried when my child goes to school that they're not going to do, they're not going to be safe or something like that. Versus I'm worried that tonight when I put my daughter to sleep, I'm going to strangle her.
Right. Right.
It's like
There's
just like a little bit of a little difference.
Yeah, it tends to be like the delineating point in my mind is if most people would tend to worry about those kinds of things, at least to some degree,
Yeah.
and it's just heightened or exacerbated, that's where I would put things into sort of a generalized anxiety realm. Although
Yes,
that's not
exactly.
completely neat and clean because relationship
It's not.
anxiety and relationship OCD are all sort of meshed
Yeah.
in together too. But then the OCD, the themes tend to be a little bit more unlikely or bizarre, right? The concern is a little bit more extreme, not
Far-fetched.
far-fetched, not necessarily something that somebody would be worrying about with in general. So yeah, I think far-fetched is a great way to put it.
Yeah.
Um,
So this subtype, that's such a hard question to answer. I think it just that could be true for all of them.
um, yeah, yeah. I think
Or are they talking more about like they're going in with complaints to somebody who's not specialized in OCD and they're saying I'm hearing voices, but like it's not voice. Is that
I don't know. I mean, honestly, I don't know what this particular person is talking about. I think the only thing I was going to say, I don't know about generalized anxiety in particular, but I would say that sometimes it could be that somebody gets misdiagnosed as having depression, for example, because and really what it is they're so worried about it that they're hyper focusing on the potential small indicators that they could be, and they're also talking about the concern about it. Does that make sense?
yeah, totally. That's what I
Like
was
I can
trying to say, I think.
oh well yeah, I'm just my brain,
But
so
you
I'm
said it way better.
I don't think
Okay.
I did.
No, you did.
um Next question, should we do it?
Hmm.
Fickle finger of fate.
Yes. I lost you.
Lost you, I thought. Okay. I'm going to click randomly. Okay.
We probably only
How
have
to
time
love
for
your own
one more.
company without okay, yeah, that's a good point. I don't know that this is necessarily within the context of this particular category. Yeah?
Okay. I actually didn't hear it. It cut off
Okay.
because
Because, yeah, my phone is being weird. Let's see. Nope, that's not. Sorry, this is part of the problem with not being able to.
I know it's hard to navigate. That's why we
I'm
like to
just
do them ahead of time.
clicking. Um, um, no, I think we've kind of already touched on this, right? The idea is questioning whether or not you want to die by suicide um,
Yeah.
can come up in this sort of subtype. Um,
Which
I
reminds me,
don't.
have we done a live on that on the self harm stuff?
I think
We
we
need.
did.
I
No,
think.
we did. We did regular harm. We did emotional harm. I don't know if we did self harm.
Yeah, we can throw it in there.
That's a good one.
But I'm sure we've touched on it under the harm stuff, though. I know we have. So if that person wants to go check that out and they
Yes.
still have that question, let us know.
Yeah. Well, this is about obsessing about depersonalization, derealization disorders, but it cuts off. So I don't know. One thing, I guess I could try for one random other, but I don't know. These questions, most of them have been covered, and I can't see any of them when I'm just looking through. Do you guys recommend any therapeutic, even spiritual ways to manage anxiety? This is kind of off topic. Yes?
Yeah, I mean, it's ERP, CBT, mindfulness. I think a lot of people who are spiritual, that's such a huge word and it's
It
different for
is.
everyone.
Yeah.
So, faith plays a huge role in a lot of people's recovery, I think, as long as, not done compulsively, obviously. But
Obviously.
I've seen faith in terms of like, traditional, what people think of traditionally, be
Mm.
play a huge support in their recovery for sure.
I
And
agree.
I would say for me personally, I'm maybe divulging a little here, is that I mean, the closest thing to spirituality for me is being outside and being with nature. And I think that was a huge turning point in my recovery, was being on a hike all alone, like with silence, and I think meditating and mindfulness has been a huge part for me, but it's different for everyone. So,
It is different for everyone, but I that's sort of the direction that I was inclined to go in as well, Kelly, is like it's weird because mindfulness is itself secular, but it certainly has sort of larger existential, if not spiritual, underpinnings in
you can
terms
feel
of,
that warm, you know,
yeah,
I don't
well,
know,
being like we
grounding.
connected, right? And
Yeah,
I think
connected.
obviously there's a underpinning in sort of Buddhist philosophy, and that can come through in terms of mindfulness being the way that we connect with others. And I think in terms
Just
of
like
it
other
says,
religion,
right,
it's
yeah,
connection.
for sure. But I don't know. I think the the main thing that I want to say to this is I do like Pema Chodron's work and how it can weave into to working with OCD and anxiety. Oh my God, I have it right here. I love this book.
Yes,
Um, it's all leafed up and stuff like
there you
that.
go.
But it's called Living Beautifully with Uncertainty and Change. If you didn't read it while I was holding it up, and obviously that pertains a lot to everything that we've been talking about. And I think this idea of living with the groundlessness of life is a much larger spiritual question,
Hmm.
potentially, or at least existential question, and the ability to learn to be with the unknown without figuring it out is actually one of the, I think, larger aims, or can be a really helpful larger aim in life. Not just with OCD themes, but recognizing that we don't know so much. And certainly this past year being a great exemplar of that.
Yeah.
Um, yeah. So anyway, I don't know. That's sort of my thought on that.
So I don't think we have time for another. It's almost
I
an
don't
hour and a
think so.
half. Yeah.
Wow. Oh my gosh, is it really? Jeez.
Yeah.
Okay. We got
Almost to
to
two.
go,
Yeah.
people. But thank you so much for joining us.
Yes.
Like
Thank
Kelly
you.
said, because I did not follow any of it. If there's something that you're needing a follow up around, feel free to message us. We'll do our best. And thanks for being here.
Yeah. Thank you all.
All right. See
Okay.
you on the flip side.
See ya.
Bye.
Bye.